and welcome to another edition of Tuesdays with the Disability Policy for All. Today I have the great fortune to be talking to Shannon Haworth, who is a AUCD staff person on the Public Health team here at AUCD. So welcome, Shannon.
Thank you, Liz. Pleasure.
We're going to be talking about the health competency for people with disability that the public health team here at AUCD has developed. So, the first question is, why is the issue of health workforce competency important to people with disability and their health?
Well, people with disabilities have a really high rate of chronic disease, higher than people without disabilities, as well as health disparities. So things like chronic diseases, which happen over a long period of time, which would be like heart disease or diabetes, asthma. They have a higher incidence of that, and they lack the access to healthcare services at times. So we with the CDC created the Including People with Disabilities Public Health Workforce Competencies, and they're really for right now for current public health professionals to get them to understand the issues of people with disabilities so that we can lower those health disparities for that population and get those preventable chronic diseases down for this population. And by public health workers, I mean public health nurses, doctors, health educators, anybody who works with community health.
Thank you. I know the people with Down syndrome have heart issues. Sometimes they're more prone to Alzheimer's.
Yes.
So those kinds of things.
Yeah. So
we're talking about.
Yeah. So there's 4 competencies, and what the competencies will help public health professionals to include people with disabilities in their planning efforts and their health promotion efforts. So let's say they're having a health education fair, or they're doing health promotion about breast cancer screening. We want them to have people with disabilities in the planning process so that it can reach their communities. Instead of talking to them, talk with them.
Okay. Nothing about me without me.
Exactly.
The next question is, and I think we have talked about this, but is there a connection between healthcare provider competency and health disparity related to people with disabilities?
Absolutely. So in public health training programs, they really don't include disability at all. So you learn about preventing disease and chronic disease, but you don't learn about people with disabilities as a demographic. So if they're not learning about people with disabilities in their training programs, they don't know how to include them or know the importance of including them in planning. So I think that's the big disconnect, and that leads to health disparities because they don't see people with disabilities as part of their communities and part of the communities they need to serve. So people with chronic diseases, that includes people with disabilities too. So included in the competencies is background information on disabilities and different disability models and definitions and resources. So it's kind of like a Disability 101 for public health professionals.
Thank you. How can we make sure that healthcare providers have the competency to take care for people with disabilities?
Well, for healthcare providers in particular, we're really trying to disseminate these competencies widely, and these competencies can fit into other competencies for their professions. So it's not like it's going to be extra work. I only know of the American Dental Association, in their competencies, they have competencies on working with people with disabilities, but that's the only one that I know of. So we're just really trying to disseminate this widely And we also have training tools on our website, and I'll talk about that when you get to the next question. But and then we're hoping that people will spread the word and get the word out that people with disabilities are part of the community too, and they have to be educated on people with disabilities and their health issues.
Thank you. Is there anything else that you would like to talk about related to healthcare workforce competency?
Yeah. So we have this lovely sign that I was hoping that we'd be able to share. So everything about the competencies is on our website. It's www.disabilityinpublichealth.org. And if you also use Twitter, there's a hashtag. It's #disabilityinph. That would help spread the word. The website is really accessible. It has 508 compliance features. It tells you everything about the competencies and the learning objectives. Also, it's a call to action for professionals, so things that they can do and strategies to incorporate these competencies. And what we really like about the website as well is there's resources by topic, so that they can go ahead and just click in and find resources about disability and policy and things that they would want to know about emerging issues like housing and a lot of the things that are affecting people with disabilities. And there are also training modules that we created. That it might take, it's 6 modules. It would only take like an hour to go through them. And it gives a background on all the competencies, but also about disability and public health and the need for including disability and including people with disabilities and planning. And there's also lots of handouts, and there's a PDF that talks all about the competencies. It's accessible as well. You can just click on the links. People with, who use screen readers can use it. And also the modules, there's narration as well, so you don't have to read through them. So we're just trying to make everything as accessible as possible for people with disabilities who are in public health as well, to be able to read them. And we have this handy one-sheeter. It's also on the website as well. So it just explains the competencies and how you can spread the word on social media. So that's what I'd like to share and hopefully spread the word.
Great. Thank you. It sounds like a wonderful tool, and could be very useful and very exciting. If you have any questions about this or any other policy issues, please go to the AUCD webpage and look for this week's in brief. And if you have any questions or comment about this week's Tuesdays with Liz, please leave them in the space below. Thank you and have a nice day. Thanks again, Shannon.